Now we're going to talk about cystic fibrosis. And cystic fibrosis is a disease, it's autosomal recessive, caused by a defective CFTR gene, also known as the cystic fibrosis transmembrane conductance regulator. And basically, you can't secrete chloride, and what happens with the protein is that it's abnormal and it gets degraded, so it never actually reaches the surface. So everything that comes out of cystic fibrosis deals with the fact that most of the mucus in your body needs to be hydrated by secretion of chloride and sodium and water. But if you don't have secretion of chloride, then you have reabsorption of sodium and water, and you get this super thick, nasty mucus that plugs your body and causes this pathology. The three main things that are affected in cystic fibrosis are your lungs, your liver, and your pancreas. And the way you think about this is that it affects the weirdly shaped organs in your body. Like, look at these lungs, they're like nasty and bullous looking, and the liver is kind of weirdly shaped, and the pancreas is very weirdly shaped. But you can also think about it as like ducts that get plugged. So basically you get plugs in the lungs, which causes recurrent pulmonary infections, thick mucus, Pseudomonas and Staph aureus and pseudo, they love thick mucus and they thrive in there. Also, along with lung diseases, you get chronic bronchitis and bronchiectasis. Dealing with the pancreas, you get pancreatic insufficiency, leading to malabsorption and steatorrhea, because you're not secreting those enzymes that allow you to absorb fat in your intestine. You also get fat-soluble vitamin deficiencies because you don't have that. And basically, you also get nasal polyps, which you also find in aspirin-intolerant asthma. Usually you see a young kid in a clinical vignette, 7 to 10 years old, nasal polyps. You're either thinking cystic fibrosis, first thing that comes to mind, especially if it's Caucasian, or aspirin-intolerant asthma, which usually happens in older people. Some other things I want to talk about cystic fibrosis, it's on chromosome 7, and it's due to a phenylalanine deletion at spot 508. Another thing you see is absence of vas deferens. Bilaterally, of course. So even though it's autosomal recessive, you still get this infertility in males, so they don't actually pass the trait on. Another thing is dealing with treatment. So you get this thick mucus. What you can give is N-acetylcysteine. Now, N-acetylcysteine cleaves disulfide bonds within the mucus to make it more thin. Another place you see this is in the treatment of acetaminophen toxicity, because you want to regenerate glutathione. And how you do that is you have this GSSG, and cleave that bond right there, and you regenerate your glutathione via cleaving disulfide bonds. Another thing you see is meconium ileus with newborns. It's also a way to diagnose it. And meconium ileus is just super thick stool in the newborn. It's very dark brown, and it's just plugged up with mucus, very thick mucus in the intestine. Another thing you can do is diagnose via the sweat test, and that's looking at chloride in the sweat. Now, usually you don't secrete chloride, but you're looking at sweat because you can't actually reabsorb it either. So you have increased chloride in the sweat. So just some take-home points. You see Pseudomonas. Pseudomonas loves cystic fibrosis. You see stuff in the weirdly shaped organs, the lungs, the liver, and the pancreas, all due to thickened mucus, which you treat with N-acetylcysteine. You also see meconium ileus, chronic bronchitis, malabsorption of the fat-soluble vitamins, A, D, E, and K, because you can't absorb fat because you're not releasing those enzymes from the pancreas. And you also see meconium ileus in newborns, and you diagnose via the sweat test, and males are usually infertile because they have bilateral absence of the vas deferens.